In this tutorial, you're going to learn about goal-free evaluation. Goal-free evaluation was introduced in 1972 by known evaluation researcher Michael Scriven, and he introduced it as a counter to goal-based evaluation. What is goal-free evaluation? It's an evaluation process in which the evaluator has no knowledge of intended goals or outcomes of a program or intervention or training. The evaluator must be what is known as tabula rasa, or a blank slate, meaning they have no preconceived notions. If the program achieves the original goals, then Scriven said that it will be apparent in the evaluation, and if it does not achieve the goals, then it will not exist within the results of the evaluation. Why would an organization or an individual choose to use goal-free evaluation? Well, the biggest reason is that, again, there isn't the existence or the knowledge of the goals, and so they are not impacting the point of view or the measurements that the evaluator is using. It allows the opportunity to uncover side effects or outcomes that were not originally intended. And so you may find deficits or benefits that would not be achieved if the evaluator was solely looking for the results of the goals or the existence of the goals that were intended to be achieved. And even in the language of what the evaluator is looking for, you do not have the effect of the different words or rhetoric that is used. And you also have results that are more adaptable, or a program that is more adaptable, because the person who is evaluating as a program is ongoing is not looking strictly at the outcomes. And so there may be a lack of results at a formative assessment point within an evaluation. And so there isn't a need for alternative means or a change in delivery or a stopping of a program, because the evaluator is not looking for those specific outcomes. When we look at goal-free evaluation, there are some cons, and there are many common criticisms that have been offered to Scriven as a result of his research with goal-free evaluation. Some of the cons are that it can be nearly impossible to evaluate internally, meaning you're almost always going to use this as an outside evaluation system. And it can be difficult to determine what the target outcomes of a program are if the evaluator, for example, may overlook a particular area. And so there may have been an objective that is achieved, but if the evaluator fails to find it or look for it, then it's not going to be apparent. And so that can be interpreted as not achieving the outcome or the objective. And it also can be more time consuming and less cost effective, because generally when you are looking at a goal-based evaluation system, you're going to look specifically for the outcomes related to those objectives and nothing else. Here are some common criticisms that Scriven received for his writings on goal-free evaluation. One of the most notable criticisms in here that I'd like to point out is the one, why use an evaluator who only gets part of the data? You simply increase the chance that some of the most important effects will be missed. And Scriven says that this is a trade-off, and the most important effects are being defined here as the stated objectives of the training or the program or the intervention. And the point of a goal-free evaluation system is that you unearth all of the impacts or all of the effects of the training, not just the ones that are intended. And so there may be unintended benefits to a program or an intervention or a training. Brandon Euchre is an associate professor at Grand Valley State University in Grand Rapids, Michigan, and he has utilized and written about the goal-free evaluation system as it relates to his area of research and study, which is social work. And he has come up with his ideas for the best implementation of a goal-free evaluation system. And it's to identify relevant effects, to examine without referencing goals or objectives, to identify what occurred without prompting of goals and objectives, and to determine if what occurred can logically be attributed to the program or the intervention, and then determine the degree to which the effects are positive, negative, or neutral. He identifies some do's and don'ts. His list of do's include the most important aspect of piece of a goal-free evaluation system, and that is a screener. And a screener is the person who has the responsibility of filtering all communication related to the program or the intervention, and to make sure that they screen out any information that can inform the evaluator of the stated goals or objectives of the training or the intervention or the program. And that is the most important. So that is the person who would, all information would flow through. At this time, we'd like to point out that GFE, which is the acronym used for goal-free evaluation, also shares it is a shared acronym with good faith estimate. And we wanted to draw this parallel because when you think about the role of the evaluator, there is a lot of good faith that is put on the evaluator and trust that they're going to find the stated objectives, or they're going to find evidence of achievement or not achieving of the stated objectives. A couple of don'ts that Euchre outlines is do not communicate with program staff regarding goals or objectives if you're the evaluator, and don't attempt to find the stated goals and objectives, because again, what you're looking for is all of the outcomes. There are some analogies within other disciplines that are related, are parallel to this concept. Within the arts, you have the intentional fallacy field of the intentional fallacy, which is in the field of aesthetics, and it states that if the meaning doesn't show, then it doesn't count. So the idea is, if you were to look at a film or a painting or a photograph and you didn't have any information related to the title or the description, then what you get out of it is what is most important versus the artist telling you what you're supposed to get out of it. Within the philosophy field in ethics, we have motives and morality. And this states that morality is determined by motivation, and those would assess the act in terms of their consequences alone. So it removes the idea of motivation from judgment. And so in this case, if whoever is the onlooker, if they don't know what the motivation is, then the motivation doesn't impact it. It's just the consequences that come from it. And within the medical field, you have the double-blind study. And with the double-blind study, you have both the doctor who's giving treatment and the patient. Neither one knows whether or not it's a placebo or it's an actual medication. And so in this case, whatever the outcomes are of taking the medication are what is being measured, rather than knowing what the outcome should be. This is a scenario that somewhat outlines what could have been a benefit of using a goal-free evaluation system. After a solar energy workshop, the attendees were provided a survey, and the evaluation based on the results of the survey showed that the workshop was a failure to achieve its stated objectives. After further reviewing the results, they realized that they neglected to ask the participants who attended the workshop whether or not their home could be retrofitted. And so the program seemed to be a failure, but in reality, it may not have been, had they looked at the outcomes in a different light, and they hadn't been focusing on the stated objectives of their workshop. If there are any questions regarding goal for evaluation as we go through our discussion, please make sure that you're sharing them on the discussion board. Thank you very much.